My Lyme disease patient was afraid of seeking treatment for Lyme disease. She is not alone. I will explore the stigma surrounding Lyme disease, the impact on patients. One of the main hurdles is the fear of the diagnosis itself. Lyme disease manifests in various stages, with symptoms ranging from mild to severe, and can become a chronic condition if not diagnosed and treated promptly. Patients are aware that being diagnosed with Lyme disease can lead to skepticism from both the public and healthcare providers. This skepticism can result in delayed treatment and inadequate care, exacerbating the patient's suffering. Some articles and reports have been dismissive of compelling evidence that demonstrates Lyme disease as a complex chronic condition. This bias contributes to the harmful stereotype of chronic Lyme sufferers as hypochondriacs, individuals who are excessively preoccupied with their health without a legitimate medical reason. Such portrayals undermine the seriousness of this disease and invalidate the experience of those suffering from it. The portrayal of Lyme disease sufferers as hypochondriacs leads to significant stigma within healthcare settings. Healthcare providers may be influenced by this bias, leading them to dismiss patients' symptoms or attribute them to psychological causes rather than exploring a potential Lyme disease diagnosis. Patients may feel isolated, misunderstood, and reluctant to seek further medical help due to previous negative experiences. The development and implementation of new treatments for Lyme disease often face harsher criticism compared to treatments for other chronic diseases. This criticism stems from a combination of skepticism about the chronic nature of Lyme disease and concerns over the long-term use of antibiotics. Despite evidence supporting the efficacy of extended antibiotic therapy in some chronic Lyme cases, these treatments are frequently scrutinized and dismissed. This hesitancy to embrace new treatments limits options for patients and hinders progress in managing the disease effectively. A significant aspect of the controversy surrounding Lyme disease treatment is the debate over antibiotic therapy. Critics highlight potential side effects and the risk of antibiotic resistance, suggesting that patients should endure their symptoms rather than pursue long-term antibiotic treatment. This perspective fails to acknowledge the debilitating nature of chronic Lyme disease and the potential benefits that some patients experience from prolonged antibiotic therapy. The dismissal of chronic Lyme disease and a reluctance to support extended antibiotic treatment has profound consequences for patients. Suffering from chronic symptoms such as fatigue, joint pain, neurologic issues, and cognitive impairment, patients are left with limited options. The suggestion that patients should endure their symptoms without adequate treatment disregards the impact of this disease on their quality of life. Addressing the stigma and challenges in Lyme disease treatment requires a multifaceted approach. It is crucial to acknowledge Lyme disease as a complex chronic condition and to validate the experience of those suffering from it. By fostering a more compassionate and evidence-based perspective, we can improve the diagnosis, treatment, and overall care for Lyme disease patients. Healthcare providers, media, and policymakers must work together to reduce stigma, support research into new treatments, and ensure that patients receive the comprehensive care they need.